So you're wondering about these mixed signals, let's say, on the mask mandates themselves. You don't have to wear them on a plane. Depending on the airport, you might have to still wear it at the airport. Different cities, different ideas on this and rules and regulations. So what is a good health policy going forward here? Let's ask a darn good doctor in that regard, Dr. Frank Catasetta of the Northwell Health internist. Doctor, if you can help me with just recommending the masks or no, how do you feel about that?
Sure, and thanks for having me back, Neil. And, there is a lot of confusion, regarding this, and unfortunately, it's become a little bit of a political topic. But what I generally tell people, and this goes for whether you should get a booster and whether you should, keep up with the vaccines, it really has to do with your individual health status. For a younger, healthier person who's comfortable going out in public without a mask, I think that's totally fine. Their risk is just like it would be during a usual flu season, and we don't all wear masks during flu season. If you get the flu, you get the flu. For somebody who has a lot of health problems and who's in a higher risk group, then maybe it makes sense for you to put a mask on if you're going to be in a crowded situation like a mass transit or an airplane. Now, and if you're going to do that, then I'd rather see somebody, upgrade to either a KN95 or an N95 mask, because study after study has shown that the routine paper surgical masks or the cloth masks, or when someone just puts their shirt over their nose, is really not terribly effective at stopping COVID-19. It almost becomes a theatrical event. So my advice is, if you're high risk, maybe it's smart to wear a mask. And if you're lower risk, let's get back to normal.
So in the meantime, what is the risk health-wise, doctor? If, let's say, you choose to wear a mask because you're vulnerable or what have you, but everyone around you is not, is the purpose of the mask and you wearing it to protect you or those around you? Because the thinking was in the beginning with masks so that you don't risk contamination to others. And now, of course, it seems to be, and I'll defer to you always, doctor, others don't necessarily pose a risk to you. What is it?
So for the vulnerable, the higher grade masks are to protect yourself. They have a higher grade filtration than the cheaper, flimsier masks. So it really is to protect you. Now, will those types of masks also, if that person happens to be sick from transmitting a virus? Yes. But the problem is that the lower grade masks don't do a terrific job of stopping the spread of the virus for somebody who's either asymptomatic or is symptomatic but out in public. So they just don't block very much. The filtration on a routine surgical mask or a cloth mask, most of the things pass right through. If you blew smoke through one of those masks, you'd see the smoke comes right through, and the virus particles are actually smaller than the smoke particles. So everything's pretty much going through those. They really don't do all that much.
So this back and forth, doctor, on a third or fourth shot, a second or third booster. Where are we going with this? And what do you recommend to your patients? I guess it would depend on their vulnerability, to your earlier point, but what do you tell them?
For sure, Neil, and it certainly does depend on their vulnerability status. For most younger, healthier people, I'm telling them to hold off right now on third and fourth shots. There really is not a ton of data showing the efficacy and the benefit of additional doses, because it really doesn't stop the spreading of COVID. What it does possibly is protect the at-risk populations from serious illness and death. And for the fourth shot now, and there is even some back and forth from the CDC on this, there are members of the CDC panel just this morning who are not quite sure. This is the CDC's Advisory Council for Immunization Practice. And there are members of that committee who vote on this and are not really convinced on the fourth dose just yet for the general population. I think we would all agree that the higher risk populations, we should do everything possible to protect them. But for the general population, there really isn't enough data to show that this vaccine is effective right now. And if you think about it, the virus that we're dealing with now is so far mutated from the original strain that to continue giving the same formulation that doesn't necessarily prevent the spread, there doesn't seem to be a lot of benefit to that right now, Neil.
What about crowd situations? For myself, doctor, I like to keep about a 500-mile radius around me and the nearest person. I understand that's a bit severe, and it really doesn't help doing this show because no one's in here with me. But I kid, but to make the point, what do you recommend on that? Because there's, remember there was that Washington Gridiron dinner a couple of weeks ago. Quite a few dozens
Sure.
came out of that, testing positive for the virus. I'm just wondering, what do you recommend on that? And crowds and crowd gatherings, all of that.
I think it really depends on the level of personal risk that you're willing to take. We take a risk every day just walking out of our house. There's a risk driving to work. There's a risk driving on the highway.
True.
For a younger, healthier person who wants to go to a concert, and we assume the risk is, okay, I could potentially get sick from this, but I'm going to be sick for a few days and I'm going to get better and it won't be an issue. And for a younger person or a healthier person or even a middle-aged person who's willing to assume that risk and realize, yeah, I'm going to travel, I'm going to go on a cruise, I'm going to go to a concert, I might get sick, and if I do, I'll get better, then I think that's a reasonable risk to take if you're at higher risk. And I would tell the same thing to an elderly, ill person during a routine flu season, that, if you're at risk for a serious illness, maybe you think twice about going on a cruise during flu season. Maybe you think twice about going to a concert. And I think that their level of risk assumed has to be adjusted for their comfort level. And to say, you know what, if I get the flu, I'm at more risk, or if I get COVID, of course, I'm at higher risk than a 50 or a 40 or a 30-year-old.
All right. So in conclusion, what you're saying, doctor, is if, you're having a gathering with in-laws, best not to go. Is that about right?
Well, I think it depends on who your in-laws are, Neil. I don't know your in-laws, but,
All right. Touche, doctor. Dr. Frank Conasassa, the Northwell health internist. Very good read of these things and a calming read. We need that because I think people are getting a little crazy with this on all sides.